Today, we're gonna talk about plastic surgery myths and misconceptions. We're gonna dive in. If you thought you knew, maybe you didn't know. Let's talk about it. So myth number one. Myth number one is that plastic surgery has to look fake. If you've seen anything that I do, it's all about natural, natural, natural. Plastic surgery is really one thing that it really depends on who you're going to and what the effect is. If they choose the wrong technique, they are going to stretch your face out. If they do too much, you're going to look artificial. If they inject too much, you're gonna look overfilled. But it can be done subtly to enhance natural beauty and bring you back in time. So plastic surgery, if you've looked at any of my work, should look natural. If it doesn't look natural, that's actually one of my biggest pet peeves. So plastic surgery can look natural. Plastic surgery myth number two, all plastic surgery is unnecessary. And you can get the better or same result with makeup or skincare, or even lifestyle for that matter. I see this in the comments on Instagram, on YouTube. She didn't need that facelift. She could have gotten the same result if she just took better care of her skin, drank some protein shakes, and did yoga. Sorry guys, not true. That is a myth. Plastic surgery is actually where we are removing and altering anatomy. And the results that you see me accomplish cannot be done with lifestyle, diet and exercise, and sun avoidance. Now, I will admit those things are all helpful in terms of counteracting the aging process, but those things alone sometimes will not help you. In fact, a lot of people that I see are the most fit, healthy people, but they just have looseness to their face. And so as good as their abs are, as strong as their triceps and their biceps are, they just need help with their hands and their face, because those are two things that you can't really exercise. And so plastic surgery cannot achieve the same results as a good balanced diet, skincare, exercise, and environmental changes. Plastic surgery myth number three, weight loss and liposuction are the same thing or similar. Now, with both of these things, you're losing fat cells, right? Fat cells are being removed from the body, but they are completely different. Weight loss is a very different thing than what's happening with physically removing fat cells, which is what liposuction is doing. Now, I'm not a body plastic surgeon, so I'm not gonna step out of my lane, but if you think about what I do in the face, sometimes I liposuction. And when I liposuction, or what I like to call lipocontour, I'm removing fat cells, but I'm not really trying to make people really lighter. Fat does have weight, and when I remove this from their face or their belly, whenever I'm doing things like that, the goal is to reshape, recontour things, not actually physically change the scale. When you're doing liposuction and when you're doing tummy tucks, things like that, there is some weight that's lost, but it's not a global weight loss, and it is not a substitute for living a healthy diet and actually being at a healthy weight. So they are not the same. Myth number four, plastic surgeons are all the same, right? And so we've seen this. One result is not the same as another doctor's result. And this is kind of how life is, right? I can hold up a can of soda and you might think it's Pepsi, you might think it's Coca-Cola. They taste different, right? They have different effects and different outcomes. Even if you drink a glass of water, you can drink 5 different brands of water and they all taste different. How is that possible? Because there's little small nuances in the techniques and the vision that that plastic surgeon brings to the table. So it's really, really important to really do your research to figure out, how is this person different? Do I really like their vibe? Are they well trained? Are they board certified? Because there are a lot of doctors who are not plastic surgeons doing plastic surgery. There are obstetricians, for God's sakes, doing tummy tucks, right? There are dentists doing facelifts. Facelifts, that's crazy. But there are a whole broad range of doctors who call themselves cosmetic surgeons. Cosmetic surgeons are not plastic surgeons, they're cosmetic, meaning they generally come from general surgery or a different background, and they do some training in the field of plastic surgery. They then market themselves as a plastic surgeon. They are not board certified in either the American Board of Otolaryngology, head and neck surgery, American Board of Facial Plastic and Reconstructive Surgery, or the American Board of Plastic Surgery. So they're not actually plastic surgeons, and they can't actually truly market themselves that way. They're not gonna tell you, right? But if you look closely, you're gonna see cosmetic surgeon. Read the fine print, Be wary and actually do your research about your surgeon and the outcomes that they can provide. Myth number 5, plastic surgery is just for old people. Guys, this is old school. That's an old way of thinking. Our techniques have evolved and plastic surgery can be young people and old people, even as it relates to facelifting. The youngest person I've done a lift procedure on was 33. The oldest person was 88 years young. You can take a look at her video right here. Each of these people have a different concern. And so as a plastic surgeon, I have to address the concerns of my patient. And sometimes aging, it happens when you're young and it bothers you. And if you have enough laxity or you have a concern that can be addressed when you're young, it's always the same. You have to weigh the benefits and the drawbacks for each specific patient to try to make them happy. There are a lot of young patients who I say no to, but sometimes when you're young, right, you need a rhinoplasty. In fact, some of the best time in our life to get a rhinoplasty or a nose job is that transition from high school to college, when you're going to introduce yourself into a new environment and you want to feel better and more confident in yourself. We actually do ear pinning surgery or otoplasty in children as young as 5 years old. Now, why would we do plastic surgery in a 5-year-old? 5-year-olds, that's usually when they're going to school. And at that stage, their ears are almost adult size. And so we can avoid the social pain and the bullying that goes along with having, prominent ears. We can do it at that stage and it won't have any long-term effects. They just have the ears that they otherwise might try to pursue as they become adults. And we can avoid that whole issue. Not that I'm advocating for plastic surgery for babies, guys. This is not what I'm doing. Plastic surgery is very nuanced and it really takes a special nuanced approach and a discussion between the patient and the surgeon, sometimes the patient, surgeon, and parents to figure out what is best for that person. Plastic surgery myth number 6. Plastic surgery is just for women. Now, I'm not gonna lie, plastic surgery is dominated by female presence, but I have a lot of patients who are also men. You can check them out here, or maybe here, or here. Men get plastic surgery. We're all humans. We all wanna feel better. We all wanna look good in our skin. So there's no rule that says only women can get plastic surgery. Male plastic surgery is a little bit more challenging because you have to respect the anatomy. Most men are not trying to feminize their look. And so if you're not doing plastic surgery procedures the right way, you can end up looking feminized. Even though it's not for just women, it's really important when you're dealing with a man to really respect the anatomy and keep masculine if that's what they're going for. Myth number 7, plastic surgery is just for vanity. It's just for people who want to look better. It's superficial. It's not really that important. This is probably one of the biggest misconceptions out there. And the reason why is people don't see what I see. The way we look, the way we present to the world has a very deep meaning on how other people perceive us. But more importantly than all of that, it's how we feel about ourselves when we look in the mirror. And what we see can reinforce things that we want to change. And sometimes that has an effect on our outcome of positive thinking, on our outcomes of how confident we are. I try to always screen my patients. What are your motivations for doing plastic surgery? And if they say, oh, I want to do plastic surgery because I want to make my ex-husband mad, right? Wrong answer. This should be for you. And you want to feel good because of you. Plastic surgery is not for vanity. Sometimes I do plastic surgery to rejuvenate people's faces, but sometimes I do plastic surgery because they got a gunshot wound, or maybe they were in domestic abuse and their nose is broken and deviated to one side. Maybe they had skin cancer and they no longer can move their face. Maybe they've been burned with acid and someone threw acid on their face and I want them to look and feel better. So plastic surgery is both cosmetic and reconstructive, but it's all the same tools. It really is not just one thing, and it is not just about vanity. A little vanity and never hurt nobody. Myth number 8, Botox and fillers, same thing. People come into my office all the time. Typically, they're new to the idea and the concept of plastic surgery, but Botox, neurotoxins is one thing, and fillers are a completely different thing. Fillers are for volume. We inject substances into the face to change the contour, to help with dark circles, maybe add a little bit of cheek, maybe to add a chin. They're changing structure. Whereas Botox and neurotoxin really help with lines of motion, right? They're weakening muscle to usually improve signs of fine lines or kind of crow's feet, anything like that. That's a Botox thing. So you're weakening the muscle and the contraction at the skin to deal with lines, whereas filler can help with lines, but it's not lines of motion. It's really lines at rest, okay? So the two different things, completely different treatments, and it's important to understand that. So if you say, hey doc, I want some Botox in my chin, it could be, I want Botox in my chin so there's less dippling and rippling. It could be, hey, I want some filler in my chin because I want more of a masculine or more of a feminine chin. It really depends, but now you know. Myth number 9, once you get plastic surgery, it's a slippery slope when you keep getting more and more procedures. Now, for some people, this is the case. For others, it is not. When I have a patient who I've done surgery on, during the consultation, I ask them what their goals are. If their goal is, hey, I want a rhinoplasty and that's it. That's all we're gonna do, because I can't do better than something that doesn't bother you. I can't make your eyelids look better if they don't bother you, right? But if they say, hey doc, I want a facelift and I want my eyes done and my lip done, I'll do that for them, but we'll also evaluate, is there something else, right? Are we leaving anything on the table? Because in my experience, if I make their face and their neck look good, but I'm leaving their eyes looking old, more than likely, appropriately, they'll come back and they'll want something more done. It's up to me to try to figure out, and the patient, to do soul searching. Sometimes it's a constant seeking of more and more and more. And that's where we have to slow down and say, hold on, what is our goal? Because perfection is not really what we're able to get, right? So are we just chasing more and more skin just to chase it? Or are we trying to make you look like something you've never looked like? Or is there something that's bothering you that plastic surgery can't solve? And so when people are kind of thinking about the slippery slope of plastic surgery, it's really important to take out the psychiatry, the issues, the dysmorphic ideas that people have about themselves, and separate that out early so that we're not chasing a neurosis, right? So super, super important. The other thing is, once you give a person a really good result, they are going to forget about that thing that bothered them. And then their eyes might key on something else that does bother them. Sometimes that's a real and it's legitimate. And sometimes I have to hold the person back and say, listen, I know this is there, right? There's a little fine line or a wrinkle, but what are we actually going after? Because that didn't bother you before and you look fabulous. So maybe we should just stop here, because every single thing that I do has a risk and a benefit. And if the benefit outweighs the risk, beautiful. If the risk outweighs the benefit, or if the risk is significant, but the benefit is so small, maybe we should hold off on doing it. So it's very, very tricky. I deal with this every single day in my practice. That's myth number 9. Myth number 10, plastic surgery is painful and you need a long time to recover. People are always amazed that my patients can look so good on day 1, maybe day 7. How do they look so good? It's all about tissue technique, tissue handling, and really minimizing swelling and bruising. And for 90% of my patients, I tell them they'll look good enough to see friends and family 2 weeks after surgery. In 3 weeks, they can start exercising and they really don't need to do a lot of downtime. The next day after surgery, you're up walking around. Now, this is for facial plastic surgery. In specific, my patients in facial plastic surgery. With body plastic surgery, there could be a whole lot more recovery, BBL pillows and laying down on your stomach for months. All of that kind of thing does not apply in the world of facial plastic surgery. At most, people are gonna have a head wrap on for a couple of days. They're up walking around. Minimal pain pills. A lot of my patients don't even take any pain medication. It really is very manageable and you're up on your feet very soon. Okay guys, that was 10 misconceptions about facial plastic surgery. I hope you guys learned something. I'll see you soon.